Hey guys, and welcome back to my channel. My name is Silibaziso Mupereki. I'm a fourth year nursing student, and on this channel I create content about everything to do with university life, nursing school, and international student experiences. And if this would be the type of content that you'd be interested in, definitely subscribe down below and turn on notifications so that you do not miss any of my videos. So today I'm going to be doing a quick Q&A about all the questions I've been getting about nursing. If I don't answer any of the questions that you might have asked me, please check out the live that I did. I will link it over here that I did. I answered most of the questions in there, but these were some extra ones that I got, and also they needed me to be more in depth, and it wasn't necessarily linked to the video that I did a few days ago. So the first question is going to college a bad thing? And I get this question a lot, and I think there's a big debate about whether you should go to university or a college to get your nursing degree. And the answer is it depends on what type of degree you want to get. So if you go to a college, you can only study a diploma in nursing, which will be at an NQF level 6, and it's 3 years, and you graduate as a registered general nurse, and there's no specialization in it. I have done a video on this already, so you can check that out. Whereas at a university, it's 4 years, and you graduate as a registered professional nurse and midwife, and you graduate at an NQF level 8. So depending on obviously your budget, because some people go to a college because it's cheaper, but also depends on type of degree that you're trying to get. Are you trying to get a diploma, or are you trying to get a degree? So it's not bad, it just depends on your personal circumstances. The second question that I got is, are we allowed to wear scrubs? Simple answer, yes. But when you're a student, there's certain privileges that you might not always be allowed to use freely. So in some wards, they might not allow you to wear scrubs because either the operational manager is really strict and they don't like nursing students to be wearing scrubs because you're not a registered nurse. There's also that whole issue where you get mistaken for a doctor and that sort of thing. So in some wards, they don't allow it. But if you're in a ward that allows you to wear scrubs, they can only be navy blue, and you must make sure that you've got a name tag on, or it's written on your scrub that you're a nursing student, or you write your name and then say nursing. So there's that differentiation between a nursing student and a doctor student or a medicine student. So yes, you're allowed to wear them, but obviously after you graduate, you are allowed to wear them, and depending on the ward, they have different colors. So I know in the maternity ward, the colors is usually like a maroon burgundy color, and then if you go to other wards, they have light blue, some have pink. I know when I was working at the antenatal ward, she was wearing like a purple color. So when you become a registered nurse, there's so much freedom about what you can wear, but as a student, it has to be navy blue, and you need to make sure that it does say that you're a nursing student. And please make sure that you also have the buckles on. Like with my uniform here, it's got those white buckles. On your scrubs, you can also get that put for you, or you can just go to a tailor and they can put it for you so that you're able to put your epaulets, because these are your identification items, and anyone from a distance can tell that you are a nursing student. The third question I get is, what are my options if my marks do not allow me to get into nursing? For me personally, I would suggest that you go back and like take a gap year and redo your metric so that you can have the right subjects, because I get a lot of DMs from you guys asking, can I do nursing without biology? No, you need life sciences. It's a compulsory subject for you to have to do nursing. So if you didn't have life sciences in your metric, then I would suggest that you go back and you do life sciences. And obviously, if it wasn't that great and you get rejected, you can just take the gap year and just improve your marks and register for the following year. If you do not want to go back to school and improve your marks, you can always try to find another degree that you can get into with the marks that you have, that will allow you to branch into nursing. But it's not always guaranteed that you get into it, but it's possible, because there's some people that can, the lower marks that you have, you end up going into physio, but you went nursing, or you end up in some education or business. Then after your first year in physio, if your marks are really good, then you can transfer into nursing, and if your marks are really good, then you're highly likely to get into it. But it's not always guaranteed that you will get in, but that is another option for you. You can also apply to a college and see if you can later on move your credits to a university. But for me, I personally think that the redoing of your subjects is a much better chance for you, because you can improve your marks and actually get better marks than you did when you're in matric, and you can actually end up being able to apply for more than one university and also more than one course because your marks are better. And you can also speak to your high school, because there are some high schools that allow you to just do the subjects that you want to improve on, and there's also some adult schools that are available where you can just do the subjects that you want and they end up being on your matric certificate. So that's another option for you. And then I get this question a lot: what do midwives do? The proper definition from Google is that it's a trained healthcare professional that supports and cares for a woman during her pregnancy, which is the antenatal period, during labor, and postnatal. So it's a person who is involved in the whole journey of a woman during conception, pregnancy, labor, and afterwards. So pretty much from the day you conceive until 6 weeks after the baby is born. Then after that, it's usually like a different nurse that's involved, like it's a child health nurse that would be involved with your baby after 6 weeks, and it's not really your midwife that would be involved in that. But yes, you can have midwives that are still involved in that process, but majority of the time it's still up to that 6 week period. And then I get a question: do midwives have a lot of independence? Yes, we do have a lot of independence. We can deliver babies on our own without the doctor's intervention, especially in an MOU or in a clinic setting. All the wards are run by nurses, and doctors only come in if you have an emergency, like the woman has a PPH, there's a resuscitation for a baby. But most nurses that are in MOUs, they're advanced midwives, and as a result, they usually can handle those type of situations by themselves. But when it comes to issues like PPH, where there needs to be blood transfusion, then obviously a doctor needs to get involved. Or if you've got a breach, or you've got a cord prolapse, then when it's like serious cases, then doctors obviously need to get involved because they've got more expertise on it and that sort of thing. But majority of the time, midwives, they're doing deliveries on their own. And it's the same thing as in a hospital setting, but in a hospital setting you have a lot more doctors doing rounds than in an MOU. In an MOU, I've only ever seen doctors when we're in emergency. The rest of the time it was just nurses. But in a hospital, even if it's not an emergency, a doctor might just want to come and help you deliver the baby, or you'll have students that want to come in and deliver babies and that sort of thing. And then the fifth question is, who chooses placement? So in the previous years, or when I started in first year, each university has a certain healthcare facilities that it works with, and so you can't just say, oh, I've got this hospital close in my house, I want to go there. No, it doesn't work. They have a certain number of healthcare facilities that they're in connection with, that they're in contact with, and also the supervisors that supervise you at the clinical placements need to be able to travel to those places, and as a result, it's a specific number of placements. And as a result, what would happen is they would take us with the year that you're in and then divide you among the different disciplines that you need to be doing for that year level, and say, okay, you're going to these hospital, clinic, whatever. And then you would try to make it there if you're able to, or you can ask to swap with someone if it's too far away from your house, or you can speak to your clinical coordinator to see if they can swap you around with someone. Usually they'll cater more for students that are outside of campus or outside of residence, because we have to travel. Students that are within residence, the school provides transport for them, so they don't really have a choice, if that makes sense, because they're being transported to those different facilities. And then over the past few years, it has improved, where they now focus a lot more on where your address is, and also we've been given a choice. Oh wow, I didn't realize it was like this whole time. Wow. Okay. It's gotten better over the past few years, where they now allow you to choose like 3 facilities, like your top 3 that are the closest to you. And also if you have someone that you travel with, like you've got a travel buddy and you guys need to be at the same facility, they've also been willing to cater for that. And like recently, now in our 4th year, there's this new like online system that they have, where they give you a list of all the facilities that you're able to go to for the discipline that you're going to, and then you choose your top 3, and they try their best to accommodate you. It doesn't always work out for everyone because there's a lot of students to cater for, but they try as much as possible, and you can always ask within your year level if you can swap with someone and that sort of thing. So that's how placements work. What has been your favorite nursing specialty so far? definitely midwifery. If you haven't seen that video, I'll link it over here so you can check it out. I've been loving everything to do with labor, pregnancy. I've just been loving everything, but definitely labor has my heart. It's such a beautiful experience to be going through that whole process with a woman when she gives birth. Then you're the first person to touch that baby, you see that baby and it over to the mom. It's such a beautiful experience, but I've been loving the whole process. Like, I've even had a few moms where I saw them during antenatal, and then I've helped a few actually deliver babies, and then I've actually ended up with some in postnatal, and I've seen them through the whole journey. So that has been really amazing to go through that whole process with them, and it's been so much fun. So definitely right now midwifery has my heart. But if I don't get into midwifery, surgical is really for me. So cardiothoracic or orthopedics, I love everything. I think it's really exciting when people go to surgeries, you're preparing for them. I don't know, there's a lot of adrenaline rush that goes with it, so I'm really excited for that. But for like the next like 2 years or so after I graduate, I really just want to be moving around between different disciplines, because within nursing, like during your training period, you don't really get to experience everything that nursing has to offer, and there's a lot of things that we actually do not know, are not exposed to while we're training. So I really just want to move around and see how different hospitals work, how different disciplines work before I actually settle down on one thing. But I definitely know that pregnant moms have my heart. And then the next question is, does nursing get easier as the years go by? um I wouldn't say it gets easier. I feel like it gets harder. Like, I feel like I was a lot more relaxed in first and second year, because first and second year was mostly like medical and surgical, and yeah, it wasn't a lot of work. It wasn't a lot of, like, we weren't working as many hours as we're working now. But like third year midwifery is a lot. There's a lot of theory that you need to know, there's a lot of practicals that you need to be doing. And also, I don't know, I feel like nursing is really real when you need to deliver a baby, because you've got the mom's and the baby's life in your hands, so things get real very quickly. And in fourth year, we're going to be dealing with psych patients, and I know that's going to be a lot. I've dealt with psych patients like briefly in medical wards, and they're a lot to handle. So now being thrown deep into it, like, psych patients are just not my thing. So I don't think it gets easier. I feel like it gets more real. Like, okay, you actually a nurse, you actually not just there to bed bath patients and that sort of thing. So because that's how I thought first and second year was. So no, it doesn't get easier. You just learn to manage it. Honestly, you really do, because the workload becomes a lot more, and you just learn to manage it and keep it pushing. And the last question is, how do I get into nursing? I have done a lot of videos about this. I'll link the playlist over here so you can check it out on how to get into nursing. And from April till mid-May, I'm going to be doing a whole series of how to get into nursing. So I'm going to be going through everything on how to do applications, which universities to choose, NBT tests, how to prepare for them, bursaries, SANG regulations, SAQA and USEF, and all of that. So the whole shebang to do with applications is definitely gonna be from April. So I'm really excited about all of that. There's a lot of work at hand behind the scenes, so don't worry about it. Turn on the notifications so that you do not miss any of those videos when they come out. But yeah, these were all the questions that I got. I really hope you guys understand a few things that happen within nursing, and if you guys have any more questions, definitely comment down them below in the comment section, or just DM me, and I can do these Q&A sessions regularly, so that I just answer questions, because my DMs get very overwhelming. I get a lot of questions, and majority of the time it's the same questions. And this saves me time, because then I don't have to answer like 10 people the same question. I'm just like, okay, cool, here's the link, please go watch it. Because I feel like you guys have a lot of questions, similar questions. But anyway, I really hope you guys have been helped with this Q&A session. Until next week, Friday, 12 p.m. South African time, have an awesome semester. Bye, guys.